Now, researchers at the University of Idaho are getting a big boost. Our Lindsay Amundsen shares how an $11 million grant will fund research on cancer and COVID-19.
I was pretty happy. So this is our major source of funding for the Institute, but it's not the only one. But without this, we would have not been able to maintain this wonderful core facility we have.
Their modeling uses mathematical formulas to replicate and predict real-world behavior. This fund will help them continue their research on biomedical imaging of breast cancer, studying the genomics of breast cancer, and human microbiome research.
Our goal really is to make Idaho more competitive in terms of biomedical research and to do modeling that really helps the state and the nation.
Along with this grant, the IMCI received a supplemental $492,000 grant to fund COVID modeling for rural communities in Idaho.
We have been helping the Idaho Department of Health and Welfare make predictions. We take the data that are available and sort of predict the trajectory of things using what is called an SIR model.
The Institute is also using the funds to develop what they call an agent-based model.
To look at social behavior in communities. And that's what we hope to apply to the rural communities. And we're just gearing up to do a big survey of rural communities.
This information will then be used to make predictions and keep track of COVID-19, as well as give advice to Idahoans in rural communities.
All the models have focused mostly on cities, big metropolitan cities, and that makes sense because those are the places that get hit first. But that doesn't mean that rural communities aren't hit, and we've seen that a lot with agricultural workers getting hit, meat packing plants getting hit, and other things in rural communities as well.
Holly says nearly every college at the U of I uses modeling through their institute because it allows them to explore all solutions to a problem without actually having to do an experiment. Lindsay Amundsen, Idaho News 6.